this is Jessica DeMassa, and I'm here at the HISA Studio at HIC 2017, and I'm here with David. David, please introduce yourself for everybody watching.
My name is David Paré. I'm the CTO for Healthcare and Life Science in Australia and New Zealand for DXC.
Okay, so tell me a little bit about what you're working on.
Oh, do you have an hour? A lot. So I'm in charge of strategy for the business. So thinking about what's coming in 5 or 10 years. At the moment, we're sponsoring the Hacking Health event here in the conference for the second year in a row. So I was there 2 weeks ago, prepping the teams, how to pitch and all that, getting ready. So that's my role around innovation. So connecting with the ecosystem, going to accelerators, talking to startups, getting connected, what's happening, making sure that we think about all these things when we talk to customers and what's coming in the future.
Okay, so talk a little bit more about the startup scene then here. I'd be interested to get your perspective as the CTO from a very big healthcare technology company. What's the startup scene like in health in Australia?
It's changing a lot. I think I've been here, I'm from Montreal originally. I've been here 4 years, and it's changed a lot. Now you can see a lot more investments, so more and more startups are taking advantage of these. So accelerators, there's a few in WA now, there's Queensland, I have a few dedicated ones. The government is coming out in Queensland and New South Wales with innovation digital health funds specifically for startups that streamline that whole big government procurement piece, to a little one. So get a few hundred Ks to do something. Sure. So popping out here and there as more and more. I think that the challenge is that are they doing the right things? So a lot of them are great ideas, but it's not necessarily what government are doing, for instance. Like Queensland, Victoria, New South Wales released their digital health strategy in the past 12 to 18 months, and the ADHA agency released that one last week. So if you do something, look in there. There's a lot of focus. Budget will be investment and interest from all across Australia, so go look at that. So a lot of vendors, a lot of startups don't do that, so they end up with something that's interesting, but will never track into that. So
okay, so your advice is for the startup to go and take a look at that and see where the money is going to be moving.
Please do, yeah. Well, I would even say for startup looking, Google your idea. You'd be amazed how many startups don't Google their idea. They don't. I honestly, it was at pitch night, and someone come up with this and said, well, this exists already for the past 10 years, so. So look into it. There's also curated websites that exist like iMedical Labs or Startup Health in the US or Rock Health, Health Horizon in Australia. Really good curated digital health platforms of innovations. So you go look in there, what's doing what, connect with them,
What do you look for as the CTO of a big tech company? What do you look for in a startup or in an application that they've designed?
Well, I'm looking for the ones who work is the one who actually have understood the pain and the challenges and have created something to respond to that. And they've piloted, they've actually done something. It's not just a cool idea, right? So usually they're either doctors or people who've worked in the health industry who can actually understand that problem properly, these are the ones.
And tell me a little bit more about how the startups fit into your larger strategy for DXC. Why look outside of the organization for innovation?
Because DXC, we're a merger of a company called CSC and HP Enterprise Solutions for the past 4 months now. So we're a very large company, 170,000 people. Wow. So it's a machine. We're listed companies. Every quarter, numbers get out and all this. But the market's changing, so we need to change with the market. But it'll take time. Right now, we play a lot in the acute care setting in Australia, so hospital systems, patient administration systems, medication management. But the shift now is moving from value-based to volume-based healthcare. So how do you measure prevention? How do you measure outcomes for your patients and so on and so forth? So today, we're starting to do some stuff in Australia, but we're not there yet. So we need to look into, so we acquired a company called Health 360 4 weeks ago, which specializes in care coordination, which is about managing your care and preventative care around the whole health system. So that's the shift. We're running coordinated care management in the US and in the UK. Which is very different in acute care, right? But we have the data, we have the network and the scale, so we need little companies that do really good stuff to help us be better at what we do.
And on the other side of that, when you're looking at your customers, and you're planning ahead the strategy for the company 5 years, 10 years down the road, what is it that you think is going to be, I guess, the next big thing for the future? What are you looking at 5 years out?
Well, it won't be a very interesting answer because we know what it's going to be. It's just going to take time. If you look at, all right, let's take a real data point. So Startup Health has a tracker around venture capitalist investments in digital health, right? So this year they've invested at Q2 over $6 billion in digital health, right? Q1 was $2.4 billion, was the largest in the past 7 years. And it's all about AI, about AI and consumer engagements, personal health, care coordination, and analytics. It's all these things, all the very forward things, like bleeding edge things like nanotechnologies and in-body things.
Yeah.
They're happening, but we're not there yet. So it's all about, again, it's about the patient, putting the patient at the center and enabling the technologies to do that.
And data, right?
Yeah, it is about the data. Well, which is the other challenge of Australia. It's all fragmented. If you haven't read this, there's a paper called Flying Blind out of the CMCRC. It's about how fragmented the Australian market is around data and healthcare and providing solutions for that. So I encourage you to read this. It's not a solution, but it shows you how bad it is and what we can do to do it. So we're trying to help with that, but it's difficult because even if you have hospitals, there's thousands of GPs and specialists and physios and private health network, and it's funded separately. Primary care is funded by federal and state is funded by acute care. So how do you deal with that?
Right.
So it's not an easy thing to do, but that's what we're here to try.
Do you think the philosophy needs to change as well? I've heard from others that there's kind of this fear of sharing data and people are very siloed off. Do you get that sense at all?
I think that if you ask people, you and I'd rather share my health data than my bank data.
Yeah, that's true.
But if you ask government, they kind of a bit, this is why cloud is still not prevalent in health. Bendigo Health is the first hospital in Australia who actually went fully cloud on Microsoft. So private patient data in the private cloud, that's really interesting because it hasn't been done before.
Right.
But others are not following up yet. They're still very much, I want to own my data centers, I want to run my own things, but they can't. So what happens in healthcare, they're 5 to 10 years behind the 8 ball.
Right.
But if they do what they do now, in 5 to 10 years, they will still be 5 to 10 years behind. So you need to leapfrog that. The only way to do it is go through as a service model using platform type technologies. So we can provide things like that. So you want to do care coordination or you want to do analytics or genomics, you're not going to buy thousands of servers or machines or software or hire people with all these skills to do it. You need partners. So we can manage that ecosystem and limit the time to market to do that.
Fantastic. Well, it looks like the future sounds pretty bright if we were to listen to you.
It is. Massive opportunity. Great challenge, but amazing opportunity.
Is there anything that you're particularly looking forward to?
I'm looking to, more business. No, but I think again, as a patient and consumer in this model, I'd love to see more technology and less paper, so I can actually improve my experience. I don't want to go to the GP, so if I can avoid it, why not avoid it, right? So just basic things will go a long way, I think.
Yeah, I think you're right.
Yeah.
All right, great. Well, it was lovely to speak with you. Thank you so much for sharing your perspective with us. It's a pleasure having you in the HISA studio here at HIC 2017.